Hello, I'm John Butler from HTI, and I'm running 2 courses back-to-back in Sagres in October. The first course is on advanced analytical hypnotherapy and the second one is on medical hypnotherapy. And these are 2 profound areas of deep hypnotherapy. They contain a great deal of information, knowledge and skills that are part of them that enable you to deal with many problems that people present with in a hypnotherapy practice. These courses have great potential with great knowledge and, as I say, skills to enable you to go deeply into the human mind and begin to understand its power and to use it constructively in a therapy setting. And also for your personal life. Much of the training is very reflexive that we do. It's based on you working a lot on yourself as well as on working with the client. Because your ability to understand yourself and your problems is what's going to help the client a great deal. And core traits of the therapeutic endeavor, the whole therapeutic relationship, are really based around the therapist having developed within themselves. And they bring those traits, those particularly important therapeutic traits, to the session with the client. And then, of course, the client has to bring what they bring, and hopefully the therapist helps them bring out their best abilities and attributes. So, analytical hypnotherapy, as Dave Elman said, is really the crown jewel of hypnotherapy. And rather than me list a list of great topics which are very valuable to you to know about, but anybody can make a list of topics and you have no idea how much depth they'll be going into them in and what their basis of experience and understanding of those topics is. So, but we do cover with the very necessary information about maturation, the development, socialization, finding your inner self, direction in life, and the life cycle. So many of those very important topics are part of analytical hypnotherapy. Now, but if we look at the overall, in a few sentences, what's this really about? It's really about finding that true self, that inner power, which no amount of intellectual discussion and probing on its own will enable you to do that. And you have to understand what hypnotherapy really is and use it well to be able to find that inner self. Many people who meditate, many spiritual people, often do not realize that the gateway to the inner self is through hypnotherapy. And in many cultures, although they don't use the word hypnosis, they call it other things, but they're talking about hypnotic states, hypnotic trances, which enable the person to expand their consciousness and have that laser-like focus as well. That's a very relaxed focus, to penetrate deeply into it and get the messages from the inner self and be able then to keep out the external distractions. And with that really powerful focus, let's say like a laser focus, or maybe when you're younger use a magnifying glass to focus the rays of the sun and set something on fire with it. If you experiment with that like that with as a child, you'll see that it's very similar in many ways. You have that power then over your body and over your mind. Now, as we connect with that inner power, instead of it being used negatively through negative programming from ourselves, and much of that is derived second-hand and third-hand from others in our past, we can begin to program it ourselves. And we then do the very best kind of programming to enable that, to achieve very specific, powerful goals for your life. We must also deal with the past, clearing the past, which is decontaminating it, deprogramming it, and reprogramming it so that we really blast forward in life using our power. And then we're able to connect with the present. Because a lot of teachers and spiritual and religious traditions keep telling us you got to live in the now, say goodbye to the past, and so on. But you can only do that when you have enough analysis, or just breaking things down into their components, which generates enough understanding of the past. Because if you're carrying so much baggage in your subconscious, right, in that emotional inner mind, you're carrying all that with you. It's interfering with your ability to live creatively in the present and to connect with the present properly. So you've got to deal with the past effectively. So as you understand the analytical hypnotherapy, using it for yourself and for your clients, that knowledge that's coming from being in contact with your inner self, plus the release of that power, enables you to transform your life as a therapist and help the client transform their direction, their outcomes in life. I do hope you join us for that course. Now, the second course that we have is medical hypnotherapy, which is really teaching you, again, I won't go into just the list of topics and areas of the body and technical knowledge, which we do cover because we're into evidence-based, evidence-supported as far as possible. And some areas of mind, body there isn't just the evidence yet for it. Science is catching up and proving many of the things that hypnotherapists have talked about for nearly 200 years. Again, giving an overview in a few sentences. Medical hypnotherapy is really about learning the power of the mind over the body. This great dormant power, which means a sleeping power, but has to be activated through the right means to have any value. Our bodies do heal themselves. The body knows how to heal itself, and that's controlled through our subconscious parts of the brain and the mind. Now, as we begin to understand the subconscious power, releasing it through the use of emotion, belief, and imagination, we can begin to target illnesses. Many psychosomatic illnesses are coming from our fears, our negative beliefs about ourselves, our self-rejection, and so on and on. And these may require some analytical work, not being in therapy for many years, of course, but getting to the roots of them, undercutting them really, because at that inner self level, these problems begin to be understood and dissipated in many ways for the illusions that they are. And some require deeper work because they're more stubborn. They've been around a long time. Now, as we activate the subconscious through hypnotherapy, powerful suggestions, and as I said, decontaminating the subconscious of the negative effects of the past, we can target the nervous system. We can target then through the nervous system areas of the body we want to work on. We might be working on respiratory function, which can never work well if the mind is not working well. Doesn't matter how many drugs we use and how many things we use in medicine, and conventional medicine has its place. But often people are not taught about their power, and that's a great mistake, in my view, that keeps people trapped, keeps people down, because they don't understand how they can target the systems of their body, how you can boost your immune system, help your digestive system, your gastrointestinal system, your cardiovascular system, and so on. And as we can work on those areas of the brain, the limbic system, deep into the other areas in the diencephalon, where a lot of the regulation is being mediated from the conscious mind to the brain stem. We have this diencephalon area which is interactive with both, and we can, through hypnotherapy, access that part, that deep diencephalic elements which you can't just do through logical rational thinking. Then we have control over our functions in a very powerful way. We can control heart rate, blood pressure, all these things that the yogis often talked about in different cultures. And when people have powerful beliefs to get well, about getting well, they often activate those without realizing it. So that's a form of hypnotherapy in a sense. We target the subconscious mind and activate then pain control and deal with the opposition to healing, and dealing with the fears, the worries that may be getting in our way. We activate our will to live, to take us away from the will to be ill, the will to die. And we deal with all kinds of negative gains, secondary gains a person might have from being ill, which are childish, non-rational, but human nature is prone to them. That there's a part of our mind that wants attention, wants love and affection, and sometimes the subconscious has taken the emotional view the best way is to get that is to be ill, or to punish ourselves or punish others. Now, there's a lot of knowledge and a lot of skills involved in this course, and it's a very thorough, deep approach to hypnotherapy that you need for medical hypnotherapy. And we've proved it in our work clinically. We've walked our talk and worked many times within surgery and difficult medical procedures to show the power of the mind, to deal with pain, to assist recovery, and so on. So we have a really solid history, and you're in safe hands when you're learning with us then. So thank you for the opportunity to speak to you here, and hopefully you will join us on that course, and I look forward to seeing you in Sagres in October. Thank you very much again.